Cholera is one of the diseases of poverty that ordinarily we shouldn't be talking about currently. As we have it currently, we have about 17 member states of the African Union currently having cholera, with several number of cases across most of these member states. If you narrow it down to the Eastern African region, at some point we had about 50% of the 14 member states all reporting cholera. We need to be able to detect cases timely so that we can be able to respond effectively.
Cholera is not a new disease, it's a very old disease, and I think it is time for us to use data and make data-based decisions in a way that can help us to save human lives.
With the conversations around predictive models for cholera outbreaks, we are talking about being proactive, being able to see something before it happens and being prepared for it. The University of Florida were one of the complimentary trainers who came in to talk about the Cholera Dashboard.
The Cholera Dashboard, it provides a simple interpretation of the risk of cholera happening in a particular region. It gives us a 4 weeks of lead time to prepare for an expected or anticipated cholera outbreak.
So the Cholera Dashboards by the University of Florida, these are heavily reliant on NASA satellite data. So using technology, using science to be able to predict outbreaks, to be able to predict disease outcomes is going to be a game changer in what we are doing.
We are trying to build a capacity here. If it is successful, then it can basically have a domino effect and other countries and other regions can follow the similar model.
I believe maybe with this model, once we become conversant with it, we'll be able to answer many questions which are coming from the Ministry of Health. And that one will even help the government to make a decision.
At the end of the day, what comes out of the Bureau is used both by policymakers and the general public. And so then we are looking at a system that once well established here in Kenya, then we are able to support our neighboring countries through the East African Community Secretariat.
A tool that helps us to be more predictive than reactive will be a game changer in cholera control.
Because currently we are just being very reactive to things that are happening to us, but we need to get to a point where we get proactive.
The decisions have to be made by humans. So
when you use data to make decisions, there are very high chances that you're going to make the right decision.